Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on AT&T U-verse on Channel 99. I'm Dr. David Balle, and I'm your host for In a Heartbeat. Having a healthy baby is on the mind of every expecting parent. As we all know, prenatal care and nutrition is very important in fetal development. We are now also finding that breastfeeding is equally as vital to a healthy baby. In today's segment of In a Heartbeat, we are going to be discussing breastfeeding, along with its impact on the health and well-being of both the infant and the mother. We are also going to discuss the Mother Nurture Project, which is being led and spearheaded by my special guest today. She is both the creator and director of the St. John Health Outpatient Breastfeeding Clinic, and her name is Dr. Paula Schreck. Dr. Schreck, welcome to In a Heartbeat.
Thank you.
Dr. Schreck, to start out, for our viewers, maybe you could tell us a little bit about your background and your practice.
I would love to. I'm native to Michigan. I grew up in Frankenmuth, Michigan. I attended medical school at University of Michigan Medical Center, and I went out to the West Coast for my pediatric training. I'm a pediatrician, training at University of California, San Diego. And my husband and I returned to Michigan in 1997, and I've been working at St. John Pediatrics ever since. St. John Pediatrics is a general pediatric practice in our community. I became interested in the breastfeeding program and what we could do with the program at St. John Hospital soon after my move back to Michigan. And in 2004, I became the medical director of breastfeeding support services at St. John Hospital. At the time, we were an inpatient service. We were able to help mothers only when they were still in the hospital after the delivery of their baby. In 2008, however, we started a unique model for the delivery of breastfeeding support. We developed the outpatient breastfeeding clinic. With this model, we were able to see mothers back at the birthing center after discharge and address their breastfeeding problems on an outpatient basis. The visits were designed so that they were a collaborative visit between myself and a lactation consultant. So we were able to take into account mothers' and babies' medical history and medical issues. We were able to comprehensively address the problems they were having, and we were able to get them on their way with the breastfeeding, sending them back to their general pediatrician for the rest of their care. And the popularity of the outpatient breastfeeding clinic grew. We started out seeing patients one day every other week, and we're up to clinics 3 days a week now.
That's great. That's great. Dr. Schreck, maybe as long as you're talking about that, what are the benefits of breastfeeding to the newborn infant?
Well, that's one of my favorite things to talk about. Breastfeeding is a uniquely superior feeding for human babies. Breast milk has over 200 ingredients that we know of. It is an incredibly dynamic fluid. It changes over time. The breast milk that a mother makes on day 1 after the baby is born is profoundly different from the breast milk she'll make even 4 weeks later, even 4 days later. The breast milk that a mother makes in the morning is different than what she makes in the afternoon.
Really?
It's a very dynamic fluid that is uniquely suited to the physiology of the human infant. It has all of the vitamins and nutrients that are needed for the baby. It has the perfect mix of protein, fat, and carbohydrate, and it has human-specific proteins that are very gentle on the infant's gastrointestinal system and allow for the perfect rate of growth and development, not only of the infant's physical body, but also of their neurologic development.
That's great. Now, does a mother's breast milk also have immunologic effects for the infant?
Absolutely. Breastfeeding infant's exposure to breast milk decreases the incidence of minor infections and common infections, such as ear infections. Babies that are breastfed have less ear infections. They have way fewer gastrointestinal illnesses. They have decreased incidences of upper respiratory infection, colds. Breastfeeding also has more serious and far-reaching ramifications for the immune system. Breastfeeding decreases type 1 and type 2 diabetes in children. It decreases atopic dermatitis, allergy, asthma, and it has a significant decrease in serious bacterial illnesses such as meningitis and pneumonia.
What about a lifetime risk later on? Are there any benefits if a child was breastfed as an infant that may be there as an adult later on in life?
Absolutely, and one of the most far-reaching effects of breastfeeding as it extends throughout childhood is, number one, it decreases hypertension and high blood pressure.
That's fascinating.
Isn't that fascinating? And those results can be measured through the age of 12 to 14 and probably do follow the child throughout adulthood, because we know that children that have less problem with hypertension as a child will certainly have less problem as an adult in most cases. Also, obesity. This is a fascinating advantage of breastfeeding, that children that have exposure to breast milk have a decreased incidence of obesity, and that can be measured, again, through childhood, and you can start to detect the difference in the percentage of adipose tissue at age 6.
And that's, as we know, an increasing important factor today in the health of children. You know, children can be vulnerable. They're delicate. They're small. Sometimes can be higher rates of infant mortality. Does breastfeeding have any impact on infant mortality?
It does. Breastfeeding decreases the infant mortality rate by 30%.
That's amazing.
One could say, well, we live in the United States and we don't have much of a problem with infant mortality, but that's actually not the case. In our own community, the community of Detroit, our infant mortality rate is 17% in the first year of life. And this is analogous to many what we would consider third world countries. So the effect on infant mortality that breastfeeding promises is very important to our community.
What many mothers may not know is that breastfeeding also has an effect on the health and well-being of the mother as well. And maybe you can share with us what some of those benefits are.
Absolutely. Mothers that breastfeed have less incidence of excessive bleeding after delivery. Therefore, they have less of a problem with anemia. They have superior maternal-infant bonding. That decreases the incidence of postpartum depression. And there's long-reaching effects of breastfeeding. Women that have breastfed have a lower lifetime risk of breast cancer and ovarian cancer. And what a lot of moms like to hear is that if you breastfeed, you lose weight faster.
That will always be a plus for anybody.
Yes, that's right.
And what is the official, I can probably guess the answer, but what is the official recommendation as a pediatrician from the American Academy of Pediatrics in terms of what mothers should do to nurture and feed their children?
Well, the official recommendation is that mothers initiate breastfeeding immediately after delivery and continue to exclusively breastfeed through 6 months of age without the addition of water, supplements, or even solid foods. After 6 months of age, although the Academy recommends the introduction of solid foods like rice cereal, vegetables, and fruit, the Academy recommends that we continue breastfeeding through at least a year of age and beyond, if possible.
In terms of breastfeeding, are there differences among different ethnic groups or regions from one place to another?
Absolutely. Regionally, in our country, there's a much higher incidence of breastfeeding on the West Coast and on the East Coast. In the Midwest, the Southeast have one of the lower breastfeeding rates as far as regions. The overall breastfeeding initiation rate in the United States, just for background, is about 75%. So most women in the United States do at least initiate breastfeeding, but only 15% make it to 6 months exclusivity, as we had mentioned was the recommendation. Now, in our region, we do not have such a high breastfeeding rate. at St. John Hospital Medical Center, we only have a 55% breastfeeding initiation rate. And within that 55% rate, there is a racial and socioeconomic disparity. The breastfeeding rate in our Medicaid population at St. John Hospital is as low as 35%, whereas the breastfeeding rate in our private insurance population is closer to the 70 to 75 that the rest of the country enjoys. And there is a racial disparity. The African American population traditionally has a very low breastfeeding rate, as low as 25 to 30%.
Dr. Schreck, a question that would just come to mind, is there a reason that's known why that rate is low?
Well, we are trying to figure out why a particular at-risk population has such a low breastfeeding rate. And the studies indicate that it's simply that that population does not appreciate, has not really been told the health benefits of breastfeeding. And there also is a perception that they will not be able to enlist the help of other family members and other people that live in their community if they breastfeed, that if they breastfeed they will be isolated. Poor breastfeeding rates follow through generations. If your mother didn't breastfeed, you are less likely to breastfeed. So in this population, if a young African American woman delivers a baby, it's quite possible that not only did her mother not breastfeed, but her grandmother didn't breastfeed. It's possible that her sisters didn't breastfeed. So she doesn't have the family support. And also, in the health information that is disseminated to that population, breastfeeding has not been emphasized.
And what are some of the other reasons that new mothers may not breastfeed?
Well, the major reasons that mothers choose not to breastfeed are, number one, they perceive that breastfeeding is going to be painful. Mm-hmm. Again, like we mentioned, they perceive they will be isolated, that other people will not be able to help them care for the baby if they're breastfeeding. For example, they feel that that will distance them from the father of the baby. The father baby won't be able to participate in care. They worry about being able to make enough milk. They worry that their baby will be hungry.
How about if it's a working mother who feels perhaps pressure to go back to work?
Absolutely. Often they feel that, well, since I'm not going to be able to continue breastfeeding once I return to work, I might as well not even try since I'm only going to be home for 8 weeks. They don't realize that any amount of breastfeeding is better than none, and we have many ways to help them continue their ability to supply breast milk for their baby after they return to work.
That's great. That's great. Do mothers need to be taught how to breastfeed, or is it something that comes naturally?
That is a very good question. It seems like it would be a skill that comes naturally and that is instinctual. Mm-hmm. And in fact, in many other mammalian species, in most other mammals, the nursing is an instinctual behavior. The babies know how to nurse and the mothers know what to do. But in humans, although it's instinctual to want to nurse, it's a learned behavior. The babies have to learn how to do it right, and the mothers also experience a learning curve. So that's where breastfeeding support services was born.
And I think a mother just knowing that probably would feel better because it would make her feel less anxious or
absolutely.
It's just good to know that, hey, it's normal, you know, to have to be taught the right way to do that.
To feel awkward, for it not to feel perfect.
Yes.
All completely normal.
Are there any important tips that you would give new mothers who are considering who are actually beginning to breastfeed?
I would ask them to definitely consider the option, to open their mind to the possibility, even if they're the first in their family that have tried it, because especially in our community, there's lots of help for them. Mm-hmm. I would also ask them to communicate when they do deliver the baby that they are very interested in breastfeeding. That helps the staff at the hospital facilitate the first feedings after the babies are born. And at St. John, we're working on feeding the babies within the first couple minutes of life. And we now realize that those first feedings in what we call the golden hour may set the tone for breastfeeding and are very, very helpful. I would also make sure that she knows that there are places to go for help after discharge from the hospital, because the simple fact is that women that seek support for problems are more successful and continue longer.
I think having that support system in place could be very reassuring and help to ensure the success of that. Are there any complications or or negative factors associated with breastfeeding?
Well, I can tell you why women seek out our help at the breastfeeding clinic. And our breastfeeding clinic is attended by mothers and babies who are having problems with breastfeeding. The number one cause of referral to our clinic is pain. If the breastfeeding is not going right, it can be painful temporarily, and nobody likes to experience pain, especially during an experience that's supposed to be something that's special for you and your baby, and something you have to do 8 to 12 times a day for hours. So pain brings a lot of women to our clinic, and we have a lot of ways to correct that painful experience immediately, and then we can solve the problem. Also, there are barriers to some women experience either they feel like they're not making enough milk, or they don't make an adequate amount of milk. Again, that can be corrected. It can be easily measured. And we have ways to help them continue breastfeeding and get the optimal supply.
Now, Dr. Schreck, you are leading and spearheading something called the Mother Nurture Project, which was brought about by a grant from the Kellogg Foundation, which sounds very exciting. And
yes.
Can you tell us about that?
Yes, I would love to. In 2010, the administration at St. John Hospital, which is very supportive of breastfeeding, decided to look into becoming accredited with Baby Friendly USA. Baby Friendly USA is a branch of the World Health Organization and UNICEF. And Baby Friendly USA, as an organization, accredits hospitals for following the best practices for breastfeeding. It's a very prestigious accreditation. It takes about 3 years. And my hospital started along the long road of achieving that accreditation. The Kellogg Foundation, which has had its sights on the health of children in Michigan specifically since its inception in the 1940s and 50s, took notice of my hospital's efforts in that direction and asked to talk to us about our baby-friendly plans. And in those discussions, they learned about our outpatient breastfeeding clinic and the other ways that we were promoting breastfeeding in our community, and how our projects specifically benefit our community, including the high-risk community of Detroit. Hence, the St. John Mother Nurture Project was born, which not only helps to fund our baby-friendly effort, but also helps to expand the rest of our breastfeeding initiatives.
And can you there are a few tiers or segments to that Mother Nurture Project.
Yes.
And maybe you can go through those with us as well.
Absolutely. Well, first of all, as I mentioned, our hospital is well on the way now to achieving our baby-friendly accreditation. It's an international accreditation. There's over 20,000 hospitals in the world that have achieved this accreditation, but there are only 125 in the United States. So we are really on the pioneering edge of achieving the baby-friendly status. That takes a lot of work at the hospital level. We have to make sure that our policies are very breastfeeding friendly. The nurses and doctors of the hospital must undergo a lot of education to understand the changes in the policy. It also changes how we use formula. Formula is still necessary to have on hand for mothers that choose not to breastfeed and for babies that need the supplementation, but the baby-friendly distinction changes our relationship with the formula companies, as we no longer accept the formula as a gift or as a service from the formula companies, but need to purchase that. That definitely costs money.
And you also have both an inpatient aspect of the program, an outpatient aspect, and in a retail.
Yes, yes, we do have, as part of our inpatient breastfeeding program, we have a small store where women can get the best of breastfeeding supplies, pumps, some clothing, components for the pumps, breastfeeding pillows, and it's right on the birthing center. That's
great. That's
yeah.
Great. Now, you have like a Mother Nurture Club. What is that?
Yes. So in addition to the grant funding our baby-friendly initiative, the grant expanded our outpatient breastfeeding support services. We've always wanted to have a support group, a breastfeeding support group at our hospital, because in the literature it's been proven that women that meet together and support each other in their efforts to breastfeed for longer. And so we developed the St. John Mother Nurture Club, which is a support group that meets weekly in a room that we redecorated in St. John Hospital. And we have a peer counselor. This is a peer counselor model support group, which means that we have a woman from the community who successfully breastfed and who has been trained through a state program to facilitate discussions on breastfeeding. And the peer counselor model has been found to be more effective in encouraging mothers to ask questions and feel comfortable about bringing up the problems they're having with breastfeeding and support each other.
And also part of this, you have the neonatal intensive care unit. You have a follow-up program with them.
Right.
Tell us about that.
Yes. Babies who need to be admitted to the neonatal intensive care unit are the most vulnerable of the babies in our community. They're either premature or very, very sick at birth. And because of the great effectiveness of our treatment in the NICU, these babies are often ready for discharge 6 weeks prior to their due date, the date that they were due to be born. So they're still, although they're physiologically stable as far as their heart and their lungs and their temperature, when they're discharged from the NICU, they often cannot feed at the breast like a term baby.
That brings up an important question. Mm-hmm. Say a baby is very premature mm-hmm. and was in the NICU or neonatal intensive care unit. How old usually is a premature infant before that infant can breastfeed?
Well, they can usually start to feed at the breast in a limited fashion at about 31 to 32 weeks. But it's important for them to receive human milk as early as the feedings are started. The neonatologists at St. John Hospital are committed to having as many as their babies receive human milk as possible, because those figures that I mentioned to you about infant mortality for mm-hmm. term infants, it's even more important in neonatal intensive care unit, where the ingestion of human milk can decrease the chance of serious life-threatening infections like necrotizing enterocolitis by 50 to 60%. Mm-hmm. So although babies cannot feed at the breast when they're born at 26, 27, 28 weeks, they start to receive very small amounts of human milk right away. And that's very, very important. By the time they are discharged from the hospital, they're 34 to 35 weeks gestation often. And even though they still can't feed at the breast full term, we like them to continue getting the human milk. And then we developed a breastfeeding clinic specifically for those NICU graduates. So we can help them transition to feeding like a term baby. We have longer appointments, and our focus is on the premature baby.
I like that term, NICU graduates. They should probably get a diploma for going through all that. Now, a part of this as well is there's a community collaboration effort with this program.
Yes.
What about that? We're
very proud of the community piece of the Mother Nurture Project. I will be the first to say that before Kellogg came into the picture, we operated really kind of in a bubble at the hospital, mm-hmm. which sometimes we tend to do, and we didn't know what was really out in our community. But the Kellogg Foundation is committed to having organizations in a community work together. They're committed to having them know what each other is doing, avoid duplication of services, and because of their encouragement, we went out into the community, and we didn't have to go very far to find other organizations that were very interested in promoting breastfeeding. And we developed these community partnerships, and we are working together in our breastfeeding initiatives. And the partners I work with are the WIC office, the Women, Infant, Children Nutrition Office, which is funded by the federal government and the state. And the WIC office is actually housed in my hospital building.
Great.
It happens to be run by the Urban League of Detroit, and as some of the WIC offices in the community are run by nonprofit organizations such as that. And we work together very, very closely on our breastfeeding initiatives at the WIC office, feeding back into my hospital practices, and vice versa. I also work with the Infant Mortality Project. We work with the parish nurses that we can disseminate breastfeeding information to family members and grandparents and other people that may support a breastfeeding mother. So those are, and we also work with Advantage Family Health Clinic, which is a community clinic in the Detroit area.
We don't have a lot of time left, but I just want to mention and hear your comment. There's still a lot of, I would call, sort of social awkwardness, I think, about breastfeeding.
Yes.
What would you have to say about that?
Well, I would like people to perceive breastfeeding as the normal way to breastfeed a human baby, and the way that a baby should be fed. So when one feels, because people feel awkward about something if they perceive it to be the different or abnormal way. So that is how an individual can support breastfeeding in their community, even if they don't have a baby. It's by supporting the women that they see are breastfeeding. Support the women in your family that are breastfeeding, in your extended family, your cousins, your friends, and certainly then in our community.
And probably relating back to what you had said before, perhaps the West Coast and East Coast are more advanced in that than maybe we are here in the Midwest.
Yes, but we're working toward the same goals.
Dr. Schreck, if somebody wanted to get out there and in our audience and wanted to contact you in any way to see about your services and what you can offer, how would they contact you?
Well, you can reach our program on the St. John Providence website. We also have a Facebook page if you search the St. John Mother Nurture Project on Facebook.
That seems to be a popular way to find things these days.
Yes, absolutely. And we're definitely embracing the social media and developing a full complement of social media tools in order to be able to communicate with our patients who, by nature of their age, really use those tools. And then they can also call the hospital and can be directed to our department.
Well, great. Dr. Schreck, it's been a pleasure having you here. Great and valuable information, and thank you for being on In a Heartbeat.
Thank you very much.
Thank you. And thank you to our viewers as well. As always, we appreciate that you tune in and watch our show. Take good care of yourself and those around you, and we'll see you next time.